Well, welcome to Anatomical Planes Part 2. If you haven't seen Part 1 yet, it's the immediately previous video. I would suggest seeing Anatomical Planes Part 1 first because I do set off into a lot of anatomical planes and their various images. But now I'm going to just review a little bit what the planes are, and then I want to show you a wonderful website that was made by the University of Minnesota, their College of Veterinary Medicine. And they cut dogs into these three planes and made infinite number of planes, or they didn't make infinite number, I shouldn't say. They have a finite number of planes, but it's visually very thorough, and then they have sections that are not labeled, and then you click on a click link that shows the labels on that same image. It is incredible. So I just want to say, hey, if you want to study anatomy, and the way to do it, at least the gross anatomy here, one way is to look at these planes. And I'm going to be telling you about my website in the next little section, because I don't want to tell you the website for this University of Minnesota, because if they change their links and stuff, what I tell you in this video may not be correct in a half year. But I know my website will always be up, and I do make sure all my links are working. And I correspond with colleges and companies and say, hey, where did this go if I can't find it, or are you bringing that back, or if they have something incorrect or missing where an image doesn't show, I will actually correspond with them. I've done that with Colorado State, Merck, the Merck company that does the Merck Online Vet Manual. So I'm going to show you that. But anyway, let's do these planes. This is a nice little diagram I found on the internet. Here are the three classical planes. I'm going to go through slowly. If you're a learner, this is good. Transverse plane, perpendicular to the long axis of the body. So here's the long axis of the body, and that's a transverse plane. And if you looked at the face that is created when you look at that body, that would be called a cross section. And transverse planes can also be used to cut tubular structures. And when you do histology, which I will be doing a series on histology, then you can see a perfect round section of, let's say, a seminiferous tubule, or it might be off, and you know from the previous video that's called an oblique section. Well, anyway, so then when you have the transverse, you have a cranial portion and a caudal portion. A lot of times when you do a transverse in the neck, you do perpendicular to the long axis of the neck. So that might seem a little strange, but then you get the best view of the neck structure. Dorsal plane, we also know that's called the frontal plane. I always think of the surface of a water when a dog or other animal walks into a lake or river. So it divides an animal into some upper portion, some lower portion. It can never be perfectly upper and lower, because they're not symmetrical upper and lower. Now the other plane that's shown here, that basically is parallel to the surface of the screen you're looking at, is called the median plane. We know it's also medial plane and mid-sagittal. This plane divides an animal, let's say one plane, if we call it a median plane, divides an animal into a perfect left half and a right half. But if we're off one way or the other, more left or more right, then you would call that a sagittal plane. So sagittal planes cut an animal into some left portion or right portion. If you happen to be right down the middle, where everything is perfect, then that could also be called a mid-sagittal plane. But I just want to show you, this is a great diagram. It's got other words there. I'm going to scroll this up. If you want to read that, you can always pause it. These terms I'm going to make another video on, so I don't want to talk about that right now. But we're going to do anatomical planes at the University of Minnesota website. I'm just giving you a taste, so it's wonderful. Okay, so now I want to tell you my website, and I know I've done this in other videos, but if you remember this website, I have about 300 links to different websites on physiology and anatomy. And so let me do this horse one first here. Horse dissection. I think this is made by Cornell University. They dissect a horse, take pictures, make labels. It's wonderful. It's not on a plane like we're going to do with this other website, but it's like dissecting a horse. But if you look at this, there's a lot of anatomy, mostly domestic animals, but I always check the links if they are working. Let me get rid of that, I guess. I'm going to do this, and I'm going to concentrate on this one. I'm going to show you just some screen captures from this canine planar anatomy that's made by University of Minnesota and cost them thousands and thousands of dollars and thousands of hours. But it's tremendous. Okay, so it's wonderful. So now if you do click on that previous link at the canine planar anatomy, you come to this page. So basically, I want to enlarge this for a minute. And you know that if you study these planes in the previous video, then there's sagittal planes, and you can kind of see the images here. It cuts the animal, so you create some kind of left portion and right portion, and you would say this is a longitudinal view. Like, let's say if you want to look at the abdomen, you click on this, which I'll show you 2 screenshots from each of these sections. Sagittal planes, if it's perfect, then it's mid-sagittal, medial, median, transverse, perpendicular to the long axis, so you generate cross sections. So here you get a cross section. Let me see, there it is. Cross section of the abdominal cavity. Up here, the sagittal is going to give you a longitudinal section. And then down here, dorsal planes are like the surface of water when a dog walks into the water. So then what you get is some upper portion of the dog and some lower portion. And if you combine all 3 of those and look at them and look at all the labels, you get an incredible number of screenshots and structures labeled, and it looks like they have an anatomy quiz. It's been a while since I've been to that, but really want to promote their website. I'm not showing you their URL because it's not very straightforward, but I'll make sure it's always working on my website as long as it exists. Okay, so now this is a screen capture. That seems to be the best way to do this. When I clicked on the sagittal sections, and I chose the thorax. I'm up here. I think you can see me on top here. So now what we've got is a sagittal section, and there it is, sagittal slab 4 of 9. So I think they divided an animal, the dog, into 9 sections. 9 portions. I don't know if they're an inch thick or half-inch thick, whatever. I didn't read the material, the technique they use. But anyway, just to orientate you, this is cranial over here. Now they don't say that in this shot. I'm not sure if they ever do. But if you know your anatomy, you can kind of see. We'll see if they labeled this. I'm sure they did. There's the trachea. There's the heart. Blood in the chambers of the heart. This is going to be the diaphragm in here. Here's the liver. We're going to show you this. So then in there, on their page, then when you show labels, then you're going to get the next view I'm going to show you. The same photograph, but then everything is labeled, and it's incredible. So here it is. Look at this. That's the same picture. But now, instead of having show labels down here, it says hide labels, because you can click on this and then get rid of the labels. So you can look for, your heart's desire. There's a spinal cord, which let me get my laser pointer going here. Spinal cord, where's that? Right here. There's the trachea, left atrium, right atrium, left ventricle, vena cava. It's still got all the blood in it. You might say, why is the vena cava that color? Because that's blood in there. Then we've got like I said, in here, some places a diaphragm, they don't have it really labeled right here. But then lobes of the liver, pancreas back here, section of the aorta. Notice how that's not a perfect sagittal section of the aorta. A lot of these internal structures, you'll never get a perfect view because it's just the way everything is crammed in there. But I mean, wow, that's wonderful. Okay, so now here is a transverse section of the abdomen. I'm reading up here. They must have sliced the dog into 15 transverse sections. And of course, you know it has to be different dogs. You can do one dog transverse, but then you can't come back and do the whole dog again, sagittal or whatnot. So we have at least 3 dogs that have given their life for this. Maybe I don't know the sources of the animals. Maybe they were euthanized at some shelter. I don't know. I don't know the background. I'm sure they don't run off into the street and grab dogs. I know that it's all very regulated how this is done. But I want to show you a few things and then we'll show you the labels. Okay, so there's my red laser pointer. I'm going to guess this big dark structure is not the liver because I'm not sure exactly who I am. I guess I would have liked to had the cervical vertebra named. But this is to me going to be the spleen. But it's such a great view. And here is a kidney, and you might say, okay, there's 2 kidneys. You know they're in the high lumbar region. Why isn't another kidney showing? And you might say, oh, it was removed. No, the kidneys are never perfectly across from each other. So there would be some sections where you'll see perhaps 1 kidney, but the other one is either behind the screen or in front of the screen, and we've missed it in this section. Okay, obviously, you know by now blood vessels were going to be filled with dark blood, this muscles, and then they've labeled them all. So, beautiful picture. I'm going to cover it over with the exact image, but with all the labels. Let's see how we did. Spleen back here. Look at that. Kidney, so it's a left kidney, and that's another thing I should have said. This is an animal looking into the screen. So us here behind on this side of the screen would be facing the rear of the animal. So you can see down here, this is the left side of the animal, this is the right side of the animal. Because if you had taken the picture the other way on the other side, then you'd have to do the labels on the sides differently. But look at internal abdominal oblique muscles. They've named muscles, they named structures. There's the aorta and there's the vena cava. And look at the difference there. The arterial blood, aorta is the main artery, is bright red because oxygenated blood is bright red. And deoxygenated blood in the caudal vena cava coming back to the heart, well, it's oxygen poor, so it's going to be darker. But look at all the detail you get. They've named all these. There's the famous linea alba. And I know there's the spinal cord up here, so then you know up here is dorsal. I guess they didn't label that. And then this is ventral, because you know ventral, because the linea alba is a white band of tissue that runs down the mid-sagittal plane. And you often, when you do spay jobs or some kind of abdominal surgery, a lot of times for a lot of animals, you put them in dorsal recumbency. That means this side of the animal's on a table, and then you do a mid-ventral approach because that linea alba is a nice place to suture back the 2 portions, the 2 halves that have been cut. So, wow. Again, I'm totally impressed, and I could spend hours on looking at all these things. Okay, and now this is our 3rd plane. A dog cut into a frontal plane or dorsal plane. Remember, those are the same. And that means the animal is cut into an upper portion and a lower portion. I'm not sure what section I'm looking at here. I'm not sure if the next one tells us. But either, so this is a longitudinal section of the whole abdominal cavity. And they cut the dog into, they cut the dog into 10 sections going in the dorsal plane. Okay, So pretty impressive. And let's see, should I guess this? I know this is all liver. This is going to be the spleen. And then this probably is the bladder. And it looks like a female dog because this might be uterine horn way back here because this is caudal, this is cranial. You got to know that because the liver butts up against the diaphragm. So whenever you see the liver, you know that end is going to be cranial, this is going to be caudal. So let me get the labeled section. Boom. Okay, so here's their labels, and they're saying this is the left side of the animal and this is the right. So if that's the case, let's see, I'm trying to see what orientation we're in. Yeah, I think we're looking up from the bottom, I believe. Look at there, uterine horns. That could even be the ovary, but I can't really tell. The lumen of the urinary bladder, but just look how well they've labeled all these things. Lobes of the liver, costal cartilage. Costal means the ribs. Here's the diaphragm. Yes, the diaphragm separates the abdominal cavity from the thoracic cavity, which is up there. So my point here of showing you these great images is that's at the University of Minnesota website. On my main website, it's called Canine Planar Anatomy, and wow, just invaluable. And these images will be good for years, right? The dog's not going to change. It hasn't changed for 50 years in the past. Won't change for the next 50 years. So these images are, in one sense, timeless. University of Minnesota, their College of Veterinary Medicine, well done. Bravo.